This one, the Southern African Alcohol Policy Alliance is cautiously optimistic about the changes to restrictions that were announced by President Cyril Ramaphosa on Sunday. However, the organization is concerned that no specific measures aimed at reducing alcohol consumption were mentioned. SAAPA's strategic advisor, Aadielah Diedericks, joins us now live. Ms. Diedericks, good afternoon. Thank you very much for joining us here on the Midday View this afternoon. You say you are cautiously optimistic, but you are concerned that there were no specifics in terms of reducing alcohol consumption that the President announced. What were you looking forward to, or what were you expecting he would say to allay your concerns?
Good afternoon, and thank you for having us. But I think that the key issue for us is that COVID 2020 produced clear evidence that reducing availability of alcohol is a measure necessary to reduce the flow of trauma-related admissions to hospitals that then frees up hospitals to deal with managing COVID. And I think given that we are looking at a third wave, as the President has said, that we, as SAAPA, think that the country and government needs to be proactive. We shouldn't wait for when the crisis hits us, but rather that we should look at what is the measures that can be introduced now to prevent the flow to our hospitals. Currently, the bed capacity, and just to perhaps reflect on a study that was released about 2 weeks ago around the admission and operations in a regional hospital in Worcester in the Western Cape. There was, and they looked at the pattern around pre-COVID, partial ban, complete ban, and how that shifted over time. But what happened was that with the complete ban, there was a 50% reduction, over 50% actually, reduction around the admission and necessary operations, particularly around stab wounds. Now, we know that alcohol is a substance that impacts on people's ability to focus, concentrate, and to manage emotional stress.
Yeah. So we understand that, Ms. Diedericks. I think we're all aware of that. So what was the Alliance hoping for? Are you pushing for a temporary alcohol sales ban?
No. I mean, I think that the key issue is that a sales ban is not sustainable.
So what do you want? What do you want? What do you actually want?
So from our perspective, there are a few things. The one is we need to limit the hours of sale for on-consumption and off-consumption. On consumption, we are disappointed that the President is allowing the places to, that the curfew is at 11. We think that that should be at 10. That then would result in a 9 o'clock restriction in terms of on-consumption sales. That off-consumption should include a restriction around public holidays, and the day before public holiday. We've got 16 June coming up. We know traditionally in South Africa, people use public holidays as days where they come together.
So you could want to see what we saw under one of the previous lockdowns, where alcohol sales were between Monday and Thursday, and from 10 o'clock to 5 o'clock, for example.
For example, that's exactly what we are saying, is that we should be looking at the measures that worked. And we believe that the 10 to 5, Monday to Thursday worked.
Okay.
In addition, we also think that we should be looking at banning special offers. And traditionally, again, around public holidays, special offers is something that is advertised, where people buy bulk.
Yeah, we'll have to see. We'll have to see. We're going to have to wait.
Consumption.
Yeah, well, he didn't do that, and I understand your concern, and you're expressing your disappointment as the Alliance. Let's see what happens as the weeks progress and we get deeper, and hopefully not, but the expectations that we'll be getting deeper into the third wave.